Because there's been so many changes in the healthcare reform law, and the media has talked about this at length, I don't know about all of you, but I am totally confused myself with regard to the issues and what it is we need to do. As a result of that, I asked an expert, Ron Crawford, who is the Vice President of Benefits at Starbucks, who has spent years studying all aspects of healthcare issues in the new law, to help us understand the situation and to give you his personal insight and advice as to what to do. So Ron, can you explain, for me, forget everybody else, for me, what really is going on and what we need to do?
Sure, glad to. The primary goal of healthcare reform is to ensure that all Americans have access to affordable, comprehensive healthcare. But going forward, we're all going to be required to have health insurance beginning January 1st, 2014. So what that means for all of us is we're going to need to make a choice as to what plan is best for us. We're going to need to choose that plan and get enrolled. It's going to boil down to three primary choices: coverage through a family member, a spouse or a parent, coverage through Starbucks, or seeking coverage on one of the new insurance marketplaces.
So Ron, let me ask you a question. If you had a child working for Starbucks who was working 25 hours a week,
right,
what would you advise them to do?
You know, the first thing I would do is advise my child to take a look at the insurance marketplaces, see what kind of coverage is out there, see what kind of rates are available. They're likely going to be more expensive than the Starbucks option, because Starbucks subsidizes a significant portion of the premium associated with coverage through Starbucks. So we could take a look at the coverage through the insurance marketplace, but primarily the main choice is going to be between covering themselves on the Starbucks plan or joining a plan with me as their parent.
Okay. Or going out and getting their own plan, or no?
They could go out and seek their own coverage through the insurance marketplace, but what they'll find is it's probably going to be more expensive because they won't be eligible for any subsidies through the federal government because they're eligible for coverage under Starbucks.
And given the fact that Starbucks has had a great plan and going to continue to provide that plan, right, you would say stay with Starbucks.
I would say stay with Starbucks. Our coverage is affordable and comprehensive, and it's available to all partners who work at least 20 hours a week.
But it's not mandatory. They can do whatever they want.
It's not mandatory. In fact, you really should take this point in time to take a look at your options. Your best option is to ensure that you have coverage by January 2014. There are some cases where that will not be required, but by and large, the smart choice is to make sure you have coverage by January 2014. Again, take a look at your three options: through a family member, through Starbucks, or through an insurance marketplace.
Okay. You know, going back to the very beginning, this has been a hallmark of what it means to be a Starbucks partner along with Beanstalk. It's going to continue to be, and we're going to do everything we can to continue to provide you with the kind of health care you've had in the past. If you have any questions, what should they do from this point on?
If you have any questions, we have a ton of resources available to you. All of them can be found at mysbucksben.com. You can go there, you can find a number of resources and FAQ documents, you can find the 1-800 number where you can call our benefit center to get personalized help, and even for Starbucks partners that don't work the 20 hours or more, we will have a resource available to them. If you can answer 4 questions: where do you live, what's your income level, do you have coverage through your employer, and do you have any family members? If you can answer those 4 questions on this website, it will take you directly to the insurance marketplace where you can enroll in coverage. So we're making that tool available to partners who don't work the 20 hours. So we are actually making healthcare tools or coverage available to every Starbucks partner, regardless of their
Tell them where to go again.
mysbucksben.com.
Thank you very much.
Thank you.